It is every parent's worst nightmare, the sudden death of a child with no apparent reason. Now researchers have found some clues that may offer some hope. In 2021, nearly 3,000 children under the age of 4 died suddenly of unknown causes. Now, 92% were infants under 12 months old. This is known as SIDS, or sudden infant death syndrome. 8% were between 1 and 4 years old. Unexplained deaths are rare at this age, and very little is known about the cause. But a study from NYU Langone offers an idea about what may be behind it. CBS News chief medical correspondent Dr. Jon LaPook joins us now to discuss this. A lot of parents obviously concerned early on in that first year. It's so crucial. What does this research reveal, and how can parents help themselves, help their children?
Well, we're used to hearing about SIDS in the first year, and this is this sudden, unexplained death of children. So this is, over the age of 1. And they followed kids for about, they have 301 children with this tragic death in their registry since 2014. The big finding was that in 5 children who had unexplained death, who were toddlers from 1 to 4 years old, they had excellent video. And the video showed seizure activity, abnormal muscle contractions shortly before they died. And so this was a clue. I spoke to Dr. Orrin Davinsky, who's the head of the Epilepsy Center at NYU Langone, where I do work, in full disclosure. And he said that for years, medical examiners would say, what's going on? They would look at the heart and the lungs. They were normal. That was done in this case. They did genetic analysis of the heart. No problem there. What's going on? This is a potential clue.
So the seizure is the cause of death, or that leads to a cascade of problems that cause the death?
Well, first of all, in these kids, it looks like the seizure was the cause of death. And Dr. Davinsky told me just a few minutes ago, be very careful to say, look, we don't know, only 200, any death is tragic, but there were 222 deaths in 2021 between the ages of 1 and 4. We don't know how many of those were from seizures, but so if you had seen the seizure, could you have done something? This is something.
So the condition is rare.
Very rare. We really want to emphasize
panic.
This. Exactly.
So should parents be concerned?
Of course, parents are concerned. One of the things that Dr. Davinsky said is not only is this as a clue to what's going on in this unexplained death in children, which I had never heard of. I'd heard about SIDS, where there are about 2,500 deaths.
I think we all heard about SIDS.
Right. I didn't know about this. And one of the things that both he and Laura Gould, who's the lead author, said is maybe this is a clue to what's going on in SIDS. So, yes, I think it's something that we should be,
aware of. Doctor,
paying attention to.
What's actionable here, if anything? I mean, I've got a 2-year-old and a 4-year-old. Let's say I'm your patient. I come to you. I say, how do I prevent this tragedy from visiting my house?
Well, right now, I asked Laura Gould about this. She said, right now it's so rare, and I want to emphasize this, very rare, but of course tragic when it happens, that there's no obvious warning signs, but one little clue is there is an increased risk of febrile seizures. Those are seizures associated with fever in children who then go on to have this unexplained death between the ages of 1 and 4. Gotcha. Now, very important to say, super important, perspective, 3% of children have febrile seizures, and the vast majority, Dr. Davinsky just told me, go on to do perfectly well.
All right.
So, put this in perspective.
Dr. Jon LaPook, we appreciate you.